one thing we do is whenever a sexual assault victim goes to the hospital calls us and we go and meet with them there. And the thing about them coming to the hospital is they need to have a sexual assault forensic examination. And so what that is a sexual assault victim's body is actually the crime scene.
Yeah.
So the sexual assault nurse examiner, and we call them SANEs, they're the ones who do the exam. And first and foremost, they just want to make sure that the person's okay, that their immediate needs are taken care of, and then they can go into the exam. We as advocates, because we're a certified program through the Attorney General's office, we're allowed to be in the room when they're doing the examination. So that helps the victim too, because there's somebody there just for them, and we don't look at anything. We stand at the head of the table and try to keep everything very appropriate and confidential. But the sexual assault nurse examiners have to be on call. And we've had times where, we've been at the hospital on one call and then we get another hotline. That doesn't happen often, but sometimes it does. And sometimes the victims will go to the hospital in the middle of the night because maybe the assault happened, late night, early morning, and then they think about it and process it and debate whether to go. And so sometimes it's in the middle of the night or early morning hours. And so the sexual assault nurse examiners may not be there. And we'll either have to call them in or sometimes we have to schedule it for the next morning. We really don't like to do that because victims don't want to come to the hospital expecting to have the exam and then be told to come back in the morning. So if we had more nurses, more sexual assault nurse examiners, that would really help with that problem. And it would take the pressure off the ones we have now because they stay pretty busy. And some nurses can do adult exams and child exams, but some nurses can only do adult exams. So that also would help with that problem. Another thing too is Plan B, or the morning after pill. Used to, the sexual assault nurse examiners could provide it through the rape kit or give them a prescription that they could get. But now the victim is responsible for it themselves. And we checked around and, the cheapest one we found was $50. And, if you've just been sexually assaulted, you're worried about getting pregnant from it as a result, and then you have to worry about paying. We're going to try to work out a deal with some pharmacies in the area to where we can help pay for that, or at least ask them to discount it for, victims of rape. Another thing that we see regarding health care is long-term consequences of being sexually assaulted, whether someone was sexually abused as a child or recently sexually assaulted as an adult. There are a lot of things that are a result of that. Sexual assault is considered a traumatic experience, and so a lot of people develop post-traumatic stress disorder, depression, anxiety, sometimes even suicidal ideation. So there's a lot of mental health issues there to deal with. Here in San Angelo, we have a shortage of psychiatrists. If you want to get in to see a psychiatrist, it's months, before you can get in, and that's not good because if somebody's suicidal and needs something right now, they have to wait. So that's one thing. And then also just physical problems. Some people develop headaches, stomach problems, just different physical issues related to the trauma that they had during the assault. So yeah, there's a lot of health issues related to sexual assault and being raped.